Hi, I'm Dr. Hari Prasath, Senior Consultant Physician Diabetologist at Apollo First Med Hospital, Chennai. Most men know the shirt collar size. So the same way, anyone about 25 years of age, it's very important to know the blood pressure levels. So the blood pressure goals worldwide are going to be anything above 140/90 has to be treated. So it is very, very important that anyone knows the blood pressure levels. You could have an undetected hypertension without any symptoms. Not that every hypertension has symptoms. So it is very important that you check your blood pressure and make sure you know your blood pressure levels, and anything above 140/90 has to be identified and should be treated. Making sure that your blood pressures could be monitored at a clinic level, or now that we have more of home monitoring, so a digital blood pressure monitoring or a home BP monitoring is also advocated. Having a blood pressure monitor at home really helps all at home to check the levels. And someone is detected to have hypertension, and ambulatory blood pressure monitoring or a 24-hour blood pressure monitoring is also indicated, where a blood pressure monitor is attached to the body, and within 24 hours it is running across your person's body so that it tries to detect the blood pressure variations right from morning till night to see the diurnal variations of blood pressure throughout the day. And the statistics worldwide show that globally 1 in 4 of an individual becomes an hypertensive. And hypertension is one of the easiest conditions to be identified, treated, and kept under control. In case your blood pressure is not in control for a longer period of time, it can cause a breach or a break in a blood pressures because of the consistent flow or the pressure of the blood into the blood vessels, and causing a small cracks or a breach in the blood vessels, causing a nidus to have deposits of cholesterol blocks in the blood vessels, forming cholesterol plaques or blocks, eventually leading to cardiac problems, or it could lead to a block in the brain leading to stroke, or it could affect your kidney circulation, causing something like a chronic kidney disease. So keeping your blood pressure in control right from the beginning, make sure that you lead a healthy long life without any complications. So there are some lifestyle measures which as an individual you could follow to make sure that you could be off hypertension. So what are the lifestyle measures we could follow for hypertension control? The main and important thing about hypertension control is your diet. Making sure your diet has got a quantity or an advocated quantity of salt in your diet. The recommended salt intake in a person is around 5 grams or less than 5 grams in salt in diet. Most individuals consume easily close to 10 grams in a diet. So how do we check on that? Make sure, and do you know what salt is needed for? Salt is a content, or a sodium was introduced to make sure that the food could be stored or giving taste in your diet. Otherwise, there is no need for an added salt in your diet. The more the salt, the more it is going to cause havoc in your system. So making sure the cooked food, most of the diet has got an inbuilt salt in it. And if cooking, while cooking, make sure the person who cooks adds 50% of the salt what they usually add in your diet, and make sure that there is no table salt on your table to be added on extra, so that making sure just for the taste of it. So make sure the salt while cooking could be cut to 50% of what it is at home, and make sure any kind of a salty snacks which has high salt contents could be avoided. Any kind of processed food has got a lot of salt, to make sure that they could have that kind of a storage facility. And number 3, making sure any kind of a dry or fried foods like a pickles or papad, all these have got a high salt content which could be kept under control. Increasing your potassium in diet also plays a crucial role in keeping the sodium in check. So what are the diet which has got high potassium in diet? If any fruits has got, any peeled fruits again has got good fiber and good potassium. So these added together could keep your salt and the diet in check for hypertension. And what is a diet? The researchers have come out with a diet called DASH diet for hypertension patients, or patients, even normal one, who do not want the onset of hypertension. It's called dietary approaches to stop hypertension. Making sure your diet as rich in fresh greeny leafy vegetables, making sure you increase your vegetables, grains, and nuts in your diet, making sure you moderate your salt intake in your diet, and increasing the potassium in diet is very, very important. And high fiber content, balancing with a protein diet, so that the consistent energy levels in the body is being sustained. And as we discussed, making sure the physical activity of at least 1 hour of aerobic exercises in a day is mandatory, whatever age it could be, and more intense workouts for younger individuals is being advocated. The physical activity in a way reduces the blood vessel stiffness which happens in hypertensive patients. So once the stiffness comes down, the blood pressure goal is also achieved much easily. Make sure you hydrate yourself at least 3 to 4 liters of water in a day. Make sure it could be consistent across the day, so the hydration is very, very important. Catch up sleep at least 6 to 8 hours in a day. A good sleep cycle, uninterrupted sleep. Avoid making sure that usage of gadgets in the night time and things could be avoided. A good sleep hygiene is very, very important. And if you have been detected hypertensive, anyone above the goal of 140/90, after a period of lifestyle modification, all these measures if followed, and still if your blood pressure is not in control above 140/90, make sure you look out to your doctor, your physician, who could start you on certain medication, and antihypertensive medications could be started, and make sure your hypertensive goal could be reached. So all these measures, if maintained long term, you can prevent the onset of complications related to hypertension and make sure you can lead a healthy life. Thank you.